Okay, hi class. This is Catherine McAdoo. The person I chose for this case study was Amelia Sanchez. The client presents with a drug addiction and no support system inside or outside the family dynamic. Client displays a previous unwillingness to stop using drugs as evidence of an incomplete drug treatment after the birth of a drug-addicted child. Client has no formal education or work history due to drug use. As a result, client is unable to provide for her son and is at risk of losing custody. Client is also at risk for STDs due to unprotected sex, as evident by her second unplanned pregnancy resulting in abortion. Client is at risk of losing citizenship due to the poor life choices of using crack cocaine. The question was posed, how would she get treatment if she couldn't afford it? If she was my client in Houston, Texas, I would recommend that she call the Houston Council on Drugs and Alcohol, Aid in Recovery, or Riverside General Hospital. The first one, Houston Council on Drugs and Alcohol, and the second one, Aid in Recovery, are both a place where you call that they can get you a bed within 24 to 48 hours. Riverside General Hospital is free. They're all free. And Riverside General Hospital specializes in detox, depending on what the client that you have needs. I would personally recommend the Houston Council on Drugs and Alcohol for Amelia Sanchez. As a treatment plan or intervention plan, we would start with her first problem, which is the biggest, her drug addiction. Long-term goal would be to obtain and maintain sobriety. For short-term, I would like her to complete a physical exam and comply with medical advice. I would send her to the Legacy Clinic to get tested for STDs, send her to search if she had any teeth problems, or MHMRA for mental health evaluation. If she had like medical problems, like she was diabetic or something, I would send her to the Harris County Health System and get her a gold card. For another short-term goal, I would like to see the client will be active participant in the treatment program by attending and participating in scheduled education classes about chemical dependency and the process of recovery. Meaning I would like to see her get some one-on-one counseling. I would like to see some cognitive behavioral therapy thrown in there and peer educated groups. Third, I would like her to develop a sober support fellowship in the community by attending 12-step meetings. This could be AA, NA, CA, COSA. They have all kinds. She needs to learn how to network and develop a outside support group. Number two, her second biggest problem that I see was there's no support system inside the family dynamic. So for that one, her long-term goal would be maintain one's intimate relationships. Short-term goal would be, number one, to enhance her self-esteem, confidence, and self-acceptance by accepting responsibility for the consequences of one's behavior. And that would be the abortion of her unborn child and her inability to take care of her son. I would like her, for number two, to see her improve social skills, assertiveness, emotional expression, and communication by including significant others in her life, like her children, her relatives, or any sober friends that she has in the recovery program. Number three, for short-term goal, I would like to see her cope with, resolve emotional problems and feelings such as rejection by her family, depression, the unresolved grief from the abortion, mourning. I would like her to deal with some of the shame and guilt that she probably carries, and abandonment she feels by her family, by improving social support, friendships, and social pursuits. So I'd like to see her get out there and apply herself to these 12-step meetings and maintain healthy friendships. For problem number three, The third biggest problem is that she doesn't have any stability in her life. Long term, I would like to see her stabilize her finances, gain employment, and arrange living arrangements. For the short term, I would like her to avoid legal problems by staying cocaine free. I would like her to apply for child support. And in Houston, we have the Houston Volunteer Lawyers. You can call, where they volunteer their services for people who don't have the money to be able to buy, purchase a lawyer's services. So they volunteer. I would like to see her get a job. I would refer her to the work source. I would send her to job fairs. And if she's in treatment, I would like to see her tour some halfway houses before she leaves, because usually going back to the same old is not good for the client. So those are my problems and my solutions that I see for Miss Emily Sanchez. And thanks.